Nobody likes going to the dentist. Nobody likes getting needles and drills. If they have to pay at your practice, if it's a $27,000 treatment plan or a $27 treatment plan, nobody's really excited about spending money at a dentist. They do it because they should and they have to, and it is the right thing to do. That said, when times like this come, you need to make sure that when they walk in that door, it is a happy, friendly, welcoming environment. When they call into the practice, they just moved to the area, in the middle of the day, and they're confused. They've got the new job, they've got new routes, they've settling into their home, and they call you, they have a friendly, welcoming, warm reception. This is the time to put all that in place. Make that experience, for me as a patient walking in for the very first time, that first impression, crystallize that, make it as solid and strong as possible. This is the time to do that. What may be coming in a few months or 6 months or 8 months or never, who knows? Financially to hit our patients, well, we're still going to be there and we're going to deliver quality care and a great experience. We are not going to talk about the economy. We're not going to talk about war. We're not going to talk about politics. We're not going to talk about anything that has anything to do with anything else other than the treatment they need, and that, boy, it's so good that they're here. Have you ever had a patient, raise your hand if you've ever had a patient come in and want to talk politics? Yeah, so they're inviting it. Do you take it? No, and you could say, I totally understand everything you just said. We do have an office policy where we're not allowed to talk politics in the office, so I have to kind of leave it at that, but boy, I hear you. Whether you're with them or not with them, or you just don't care, that is the answer. Was that offensive to them? No, that wasn't offensive to them. But we just don't talk about that. Now, somebody starts coming in and they say, well, it's like interesting times. I don't know if I should go forward with this treatment. I think I should be doing this. I just lost a bunch of money with my crypto or my stocks, or, I don't know if my company's going to be around. This is your ABC sales and communication technology. This is where you are right there with them. Oh my gosh, I am so sorry to hear that. That must be shocking and concerning. I totally understand. They know that you've heard them. Now, they don't need to say that again. That's what happens when you give a good quality acknowledgement. Let's talk about something I think is very important as well, which is what's happening inside your mouth. And you go through the treatment plan again. This is the importance of you there during interesting times. And while doing so, you're there at whatever tone level you need to be for that person, but you yourself have the approach and professionalism there, and we keep all the unnecessary chatter out of the office. Do rally your staff around that. Make sure that your staff aren't engaging in that or any other sort of unnecessary chatter. We had one of our clients, Dr. Alex Matheson and his team in Queen Creek, Arizona. It's just outside of Phoenix. They came and relayed a story to me that was very interesting to me, which was during COVID, there are patients that were coming to their office, leaving the dental office that they came from, saying, I have to sit with my hygienist. It's a one-way conversation for 45 minutes while my hygienist is telling me about COVID, all these people who are sick, what's going to happen with the economy and all this other stuff. And I just can't have it. Like, I got enough of that in my normal everyday life. So I heard about your office. I'm coming here because as much as you can with dentistry, you keep it fun and interesting. I got enough drama in my life. I don't need it here when I'm coming to get needles and drills in my mouth. So thank you so much for just being upbeat. That was happening so often that they were getting patients from other practices because these other practices were engaging in conversation that just was alarming and down tone and not fun. I don't want you to be weird about it. Something bad just happened. Oh my gosh, I just lost my dog. Oh, well, it's time to get another one. What you gonna get? I mean, don't be weird. Don't make it weird. Don't be weird. At the same time, just make sure that conversation that just isn't helpful is kept out of the office. So that's the first point. Certainly have a meeting with your staff around that and do what you need to.